Welcome to the podcast on suicide prevention. Today I'm with Kelly McBride, who is the author of the PS Centre new material that is out, Suicide Prevention During COVID-19. And I've asked Kelly McBride, who is a technical advisor at the PS Centre, to take us through the facts and approaches that should be used in suicide prevention. So I'm Ea Suzanne Akasha from the Reference Centre for Psychosocial Support of the IFRC. Kelly, could I ask you to present yourself?
Sure. Hi. So my name is Kelly McBride. As you mentioned, I'm a mental health and psychosocial support technical advisor here with IFRC Psychosocial Centre. And my background is as a professional mental health counselor and in international human rights and humanitarian law. And so I have a background in providing both kind of direct clinical services as well as supervision, guidance, training, and support, particularly focusing on those who have been impacted by conflict, crisis, and humanitarian events. So suicide prevention and harm prevention is a key kind of area of focus for my work.
Oh, good. And could you give us starting off by giving us some main facts about suicide?
Yeah, so around 800,000 people die each year by suicide, and about 75% of this happens in low to middle income countries. And so what's interesting is that for every person that dies by suicide, around 20 people, for each of those individuals, around 20 people within the population are estimated to have attempted. Something else that's fairly interesting is to know that females often attempt more regularly than men. But men are about 3 times more likely to complete. And, I think what's important to know about suicide is that it is, in fact, preventable. And so I've talked about kind of these scary statistics, but I think the most hopeful and the thing that's most important for us today is to know that it is indeed preventable. And there are things that can be done to reduce risk.
These are staggering facts. They're overwhelming, even though I've also heard them before. I think every time I hear them, it's just so overwhelming. The number is just so alarming. And another fact is that in many communities, suicide are very stigmatized. So what are some of the key stigmas that surround suicide?
Yeah, it's really interesting because each culture, each community, it can be different how the stigmas present. And so it could be happening on an individual level where people feel a lot of shame for having maybe thoughts of suicide or of hurting or harming themselves. They might be afraid that they're going to be a burden to their loved ones if they talk about what's going on or these feelings. It can also kind of increase to a larger level, so looking at the community. So they might be afraid to be shunned by their communities. They might be afraid that their personal freedoms would be taken away. So for example, if they express that they're suicidal, then they might be taken away somewhere for their safety at the surface, but it could take away, their freedoms, particularly if it's not a safe place for them to go. And then we also talk about stigma at a level where in some societies it's illegal to engage in suicidal acts. And so we see this, even in our language and how we talk about suicide. One of the common terms that we hear is commit suicide. Mm-hmm. We think about that word commit, and it actually has connotations that you've committed a crime. So if we think about that, I think that it helps us to illustrate what stigma can look like. And all of these can serve as barriers for people reaching out to get help. It can also, serve as a barrier to being able to accurately record how big the problem is or how common it might be in a culture or community, because we might not be keeping track because it is stigmatized at the societal level. And so again, this all impacts the ability to prevent something that is indeed preventable.
I find it very interesting when you mentioned to commit suicide, and even the language around it is a barrier. And there are other barriers, and I'd like you to expand on some of the very common myths there are barriers around suicide. Like, for instance, people talking about that it encourages people to suicide if you talk about it, if you even mention it. So could you elaborate on that?
Yeah, and I think that's one of the biggest things that I've seen in my experience in the field. There's sort of this thought that if we name it, if we bring it into the room, if we talk about it, then somehow we're putting that idea into someone's head. And that is actually not true at all. And so we see this, and oftentimes in trainings, when we talk about different prevention measures, and I think we'll talk about this a little bit later, but something simple like doing an assessment of risk and talking to someone, about if they have plans or intentions. Oftentimes the feedback that I'll get back is, well, we can't talk about this because then you're planning with them. And that's actually not true. If we create a safe and supportive environment where a person doesn't feel like they're being judged, where they feel like they've got someone there who really understands and is listening to them, talking about harm, self-harm, talking about suicide, talking about suicidal thoughts, all of that can be really helpful in finding ways to, support that individual and ultimately, again, prevent suicide from occurring.
So actually talking to people about suicide is part of the prevention strategy.
Exactly.
Yeah. So let's move on and could I ask you to explain why it is important in the context of COVID-19 to talk more about suicide when you say it's preventable. So what can we do now in the context of COVID-19?
Yeah, suicide prevention is important all of the time, right? And so the guidance document that the PS Centre put out is important because a lot of the information that it talks about is actually relevant during all times. But right now, during kind of this COVID-19 era, we're seeing things that are completely different and new and unprecedented for many of us. So disruptions to our daily lives, quarantine, lockdowns, physical distancing, financial crises that are impacting so many, livelihoods. And all of this has triggered a wide range of short-term and long-term mental health repercussions. And so, there's been a lot of talk of individuals feeling maybe more anxious, which is quite normal with all of the uncertainty around us, or maybe feeling more isolated or depressed. There's also reports of, substance and alcohol abuse increasing, violence in households increasing. All of these are what we consider to be risk factors for suicide. In addition to that, we've got some groups who are a bit more vulnerable, and in particular, our healthcare workers who are facing, a fair amount of stigma. We've already heard reports of healthcare workers, harming and suiciding. And so all of these are important indicators to tell us that, we have to take our well-being and our mental health seriously, and we have to be prepared for a possible increase in suicide. There's no way of telling, if I don't think that we have the data yet to really understand if the trends are saying that there's an increase in numbers, but what's most important is that we're prepared and that we're doing things to be preventative so that we don't see a spike.
And you mentioned healthcare workers as one of the groups that are at risk. Which other groups are most at risk during COVID-19?
Yeah, so we've got a handful of different groups that, this document, the document that the PS Centre has created, that we look at, I guess, more particularly. So we talked a bit about those who have had financial concerns and job loss. So that's a really important group because trends tell us that previous financial crises have led to an increase in suicide and harming behaviors. In addition, older persons. So traditionally, those who are above the age of 70 are actually the group that comprises of the highest suicide rates. So knowing what we know about older adults at the moment, during COVID, that there might be, more situations of isolation and not being able to access social supports, that makes them particularly vulnerable because they already were a quite vulnerable group to begin with. And then we have a whole myriad of protection concerns that are really important, and we talked a bit about that as well. But protection concerns like sexual and gender-based violence, interpersonal violence, those all make individuals more at risk. Children who are, either witnessing or experiencing abuse, those are risk factors for suicide. And then a key group that might be overlooked, might not be, but those with pre-existing mental health conditions. So their supports might be impacted. The ways that they traditionally receive support, whether it's friends and family, that might be very different now. Accessing a healthcare provider might be impacted now. Access to medications, things like that. So those are all pieces of the picture that could make those who had pre-existing mental health concerns, makes them a bit more vulnerable during this time.
And from a mental health and psychosocial support perspective, that's very important to be aware and mindful of all these groups that are at risk. But and in your material, there's also a suicide prevention preparedness checklist. Could you talk a bit about it?
Yeah, and so the checklist is an intention to make suicide prevention a little bit more palatable or easy to follow for individuals. I think oftentimes we think about suicide prevention and we say, this is scary. These are people's lives. This is too big for us to be involved in. And so the intention behind this checklist is to really try to make it as easy as possible to know what's going to help you either build out programming or maybe refine your existing programming to fit in with COVID-19, but even more generally. And so the preparedness checklist is kind of 5 different sections. And so we look at first contextualizing prevention efforts. And so suicide, like just about anything else, suicide and harm, is dependent on the context we're talking about. And so the language we might use might be very different. The ways that people express that they're hurting or feeling distressed might be very different. So it's important that we talk to community leaders. We have discussions with members of the community to understand a bit more kind of what's happening and the language that should be used if there's trends within the community. Also, understanding, what exists in regards to, I mentioned earlier, in some communities it's illegal. Suicide is illegal, so understanding if there's any laws or the systems that are in place. So just making sure that whatever we're doing is contextually relevant. We're using the language of the community in our response. And then it's important to understand what resources are out there. And this can be really tricky depending on the environments that we're working in. So again, this is where it's important that we're talking to members of the community, faith leaders, in humanitarian context when we have technical working groups or coordination clusters, working with them to understand who the safe people are to work with. So the healthcare facilities, the mental health, facilities, if it's faith-based communities, first responders, all of those are really important to map and then understand what the capacity is. So oftentimes, even if a mental health, there is the availability of mental health provision, it doesn't necessarily mean that they know how to respond to those who are at risk. And sometimes they can cause more harm unintentionally by not knowing how to respond. So being really intentional during this mapping phase of understanding what resources are safe. And so that leads into the kind of third part is, making sure that they're safe mechanisms, but also that they work. And so sometimes there can be challenges in making referrals for whatever reason. So that's again where it's really important to really collaborate and to connect with other actors in the field to understand who's doing what, how best to make referrals, how best to ensure that people are getting the support that they need. And again, an emphasis on safety. So even if there is a psychiatric hospital, understanding if it is a safe psychiatric hospital for these types of cases. And then very importantly, and leading very much into this document, is making sure that staff and volunteers know how to respond. And so this one's really key. And again, it's also really quite scary and can be overwhelming, especially if you're a volunteer without much experience or if you're a staff member without much experience in this area. So there's a lot that can be done that's actually not not very resource heavy, not as, I guess, scary as it might look. Simple things like making sure that your staff is trained in psychological first aid, making sure that they know how to identify if there's risk. So being aware of the different warning signs, to know if somebody's at immediate risk or might need to be flagged for further, further consultation. Understanding, how to use those basic helping skills. So how to talk to someone in a non-judgmental way, in a way that is validating and supportive, is really, really crucial, and also goes a long way in de-escalating a situation that might feel a bit overwhelming. So these are all just, examples of things that we can train our staff in, and our volunteers. And then, in programming that does get more more focused on prevention efforts, there are different things like risk assessments and safety planning that staff and volunteers can be trained in, so that they can really help to manage the situations as they arise. And again, the key to this is not waiting until you've got a big problem where you're noticing an increase of rates of harm and suicides in your community, but really just being prepared in advance, so that you can respond if and when it does happen. And then what I feel is one of the most important things is, promoting, and this is the kind of final thing on the checklist, but promoting staff and volunteer well-being. This is so key, especially if we are, expecting people to engage in situations where people might be feeling very, very upset, very distressed. That can be a lot of pressure on staff and volunteers. And it doesn't matter what level, if you're the most seasoned professional or if you're a brand new volunteer, everybody needs support. So making sure that our MHPSS staff and volunteers and other frontline workers have access to supportive supervision structures, so that they have someone to talk to when these situations arise, so that they have that support and that they have access to additional supports if they need them. And so, promoting the well-being of those workers who are engaging in suicide prevention efforts is really crucial and key to any successful programming.
And also, I'd like to just mention that you've also written the PS Centre's material on supportive supervision during COVID-19. So I can hear and feel, sitting beside you, that it's a topic that is really, or it's an item that's really close to heart.
Indeed.
That's, yes, and it's very important. So thank you for mentioning that as well. There's also something that's quite interesting in the material about how to assess risk and protective factors. So what would be, we've talked a bit about the risk factors. So what are the protective factors?
Yeah, and so I'm glad that you're bringing up protective factors, because when we talk about suicide prevention, oftentimes the risk factors are the number one thing that's highlighted, and we kind of forget that equally important are the protective factors within a person's life. And so protective factors can be things like having, social supports, having family, friends, someone that you can talk to. If you're someone who has conflict resolution skills, you know how to manage conflict that comes up in your life, or if you have more help-seeking behaviors, people who maybe are engaged in community activities, maybe faith-based activities, or community social clubs, whatever that social engagement, those can all be really helpful protective factors. And if we're talking about children and youth, having access to a supportive adult in their life is really important. Caregivers or other individuals who might be there, particularly during a time like COVID, to help make sense of everything going on around them. And so these are all, examples of protective factors. And I'll mention as well that access to quality and safe MHPSS is also really key. So, having access to those types of supports are integral, and considered key protective factors. And so it's going to be different for everyone, though. There's no one-size-fits-all formula when we talk about risk factors and protective factors, which is why, the guidance note that PS Centre has put out, there we list those risk factors and protective factors that are known to be a little bit more common. But again, it's going to boil down to those interactions that you have with an individual to really understand what's protective to them, or what makes them feel more at risk.
So two things that I've noticed so far that you talk about is that the protective factors are actually what we are always trying to promote in mental health and psychosocial support, which is great. And also the second factor that we always stress the link with the individual, with the group, with the family, with the community.
Absolutely.
To be in touch and to understand and be on the same level and trying to create positive relations. Really interesting that you mentioned that. I would also like to hear about, there's a risk assessment that is quite detailed in the material that I really like. I think it's very instructive. And there's a script for how you can talk to people should you be counseling them or be on a hotline. So you have the risk assessment. So could you say a bit more about that? And then later on, I'd also like you to say there's also a safety plan, which is interesting because that's very concrete tools that you have created.
Yeah, and so these are, two different examples of tools that are often used for the management of, those who perhaps have suicidal ideation or are harming. And so it's important to stress that, risk assessment and safety planning, these are things that it's really important that the staff, volunteers, whoever's using it, it's important that they're trained on how to use it. And also that they have access to supervision. And so we're not suggesting that just anyone and everyone go out there and start assessing risk. It does take, a deeper understanding of kind of how it works to be able to work with it safely. And so the risk assessment example that's in the document is, something that I mentioned earlier. It's the intention behind it is to work with an individual who might be expressing that they've been thinking about suicide, that they've acted on it, perhaps in the past. Again, it's not for people who are in emergency risk, right? So if somebody comes and there obviously is an emergency medical situation, you manage that first. You get the medical care first, right? But if you're, for example, talking to an individual and they tell you, yes, I think about suicide, it's really important to explore what that means to that individual and understand the situation a bit better. That way, as a helper, you know how to respond to the situation. And so, some examples of what we would ask in a risk assessment, and in some cultures, the language might need to be refined a bit because just asking directly, do you think about killing yourself, might not go off so well. There might be other ways of phrasing and making it more culturally relevant, but that's not to say that you don't ask the question specifically to understand, do you have thoughts of taking your own life, of killing yourself? And just asking, a bit more about what that means to a person. So, there's different ways that you can ask it. Have you tried, it's important to understand if they've tried to harm themselves in the past. Previous attempts are one of our number one indicators and risk factors for someone attempting again. So that's really crucial to understand when understanding risk, when doing a risk assessment. Understanding, do you feel like dying? Do you sometimes wish that you were dead? And having this almost as a conversation. And so it's not a tick box exercise. It's not necessarily yes, no exercise. And that's how it's presented in this guidance. It's about, creating that connection with an individual so that they feel safe to tell you what's going on. If they do tell you, yes, I've been thinking about it, it's important to explore then what that means. Okay, do you have a plan? And then explore with them, what, if they do have a plan, what that means exactly. And that's going to help you to understand if they've been thinking about it. If, say, they have a plan that on Friday they're going to time with the train, they have access to a gun, and they're thinking of taking their lives then you know that you need to take immediate action for that person's safety and well-being. So this helps you to gather the information so that you know how to respond. And again, it's important to stress that by asking these questions, you're not putting the ideas in the person's head. They're already in the person's head. They're already thinking about it. And by providing that safe space for them to talk about it, you're actually, doing a lot to support them and prevent, hopefully, anything from taking place. And so this is, in short, that's what, what a risk assessment is. It's to understand, do you have thoughts? Do you have a plan? If you have a plan, tell me as much detail or as much information about that. And then from there, as a helper, you understand how to respond to the situation.
How to prevent, actually. You're going from the safe and supportive talk into the safety planning.
Yeah, and so safety planning is something that we can do, again, if someone isn't in that emergency imminent risk. So if they need support then and there, you don't leave them alone. You do everything that you can in that moment to make sure that they're safe. But safety planning is something that's really helpful and shown to reduce suicidal thoughts and actions, and particularly with displaced populations is what research is telling us. And so the purpose of safety plans is to understand for people, what their triggers are, what their warning signs are in their own lives. That tell them, oh wait, okay, this situation's becoming potentially dangerous for me. And then to help identify what different coping strategies for them are, people that they can talk to, places that they can go. And so the safety plan within the document is meant to be done in collaboration with the person who's, has suicidal ideation. And so it's meant to be meaningful for them. So again, this isn't a tick box exercise. This is something that's done collaboratively and talking to the person to make it meaningful to them. And so some of the things that we explore in the safety plan are understanding, like I mentioned before, what are some thoughts or situations or feelings that come up that might make you feel suicidal or might make you feel like hurting yourself. Explore that with them. Understand as much as possible what those situations might be, and then explore ways, hopefully, to help them to feel safer when that does happen. So what are activities that help you to feel calm? What are your reasons for living? Who can you talk to? And most importantly, what to do if you're not feeling safe. So we know that if emotions are high, if we're really overwhelmed, sometimes our rational brain goes offline a little bit. So having this piece of paper that just kind of clearly outlines, okay, I'm not feeling safe. Where can I go? Who can I call? What's an emergency number that I can call, or what's a hotline? A professional I can go to? Where's the nearest hospital? Having all of that information just clearly in front of you can be really helpful if you're in a situation where you're not feeling safe. So again, this should be done with a trained helper or a trained staff, trained volunteer, together with the individual. And then, as you continue to work with this person, and hopefully there is continuation of that relationship, and it's not just a one-off, but whoever might be working with that individual in the future, it's important to kind of update that safety plan as well, because what's meaningful for you this week, or what's a trigger for you this week, could change next week. So just making sure it's as relevant as possible as you go.
When reading the material, I found this very instructive and very useful. Should I be in a situation where I encounter somebody? So I found that very useful. And also you talk about psychoeducation for family and friends, and what should they be, and what should they be taught about? What should we psychoeducate them on?
Yeah, so psychoeducation is really key for anything that we're doing in mental health and psychosocial support, but particularly with suicide and self-harm, because there is so much stigma, there's so much misinformation, there's not always a lot of information out there. So the more information that we can provide people with, from my experience, it helps to kind of normalize what's going on. It helps to make it less scary, frankly, particularly for family members and loved ones. If you have someone in your life that's telling you that they're thinking about taking their own life, that they want to hurt themselves, that's really overwhelming. And so providing information about how to help someone to be more safe, how to support them, practical things that can be done can go a really long way. And again, helping people to understand that it's normal for individuals to have thoughts of suicide. We all think about it, at some point in our life. That's not unusual. It's not uncommon. But what is really important in psychoeducation is to help loved ones and people close to that individual understand, those different types of warning signs and things that they should be looking out for in their loved ones, so that they can help to know how to support them, and particularly when it's time to seek external help. But there's a lot that can be done. We mentioned that, the social supports of friends and family, that's a key role as a protective factor and can go a long way in prevention.
And not only people who are thinking about harming themselves, but also family and friends can call hotlines to get support, to know what they should be doing more of and what they should be doing less of.
Absolutely.
I think, yeah.
Yeah, and that's something that's really important as well. And a key thing that can be done is establishing support groups. In communities where maybe suicide is, unfortunately, we notice in communities that if there's suicides occurring, sometimes there's a bit of a spike, right? It becomes a bit of a trend. So creating support groups within communities for those who are affected. If those, individuals who have been impacted by suicide, connecting them with each other, with social supports, with support groups, I think is a key way that we can help communities heal from this, if and when it does happen.
Great. Thank you so much for taking us through what you have been working on in suicide prevention. And I would really encourage everybody to read the material, Suicide Prevention During COVID-19, and also the Supportive Supervision During COVID-19, both by Kelly McBride. So thanks a lot for joining us in this conversation on suicide prevention.
Thanks for having me.
Welcome.